And call the Fire Service Advisory Commission meeting to order, May the 20th, 2021. If y'all have had a chance to review the minutes, well, let's see here. We do have a quorum, so we can continue. You've had a chance to review the minutes? Okay. I ask for a motion to approve the minutes.
Make motion.
Second. Motion and a second to approve the minutes. Any discussion? Discussion, all those in favor, signify by raising your right hand. Motion to approve the minutes from April the 15th carried. Radio Communication Committee.
Sir, we're still waiting for equipment to come in because of the electronic slowdown getting parts. I think we're going to be held up on that. We have plans to start testing when the equipment arrives. I have not received any new reports since last month, the fire station, the rescue squads, on lack of coverage for the digital system. I haven't received any, along with that report, is supposed to come the request for additional channels that those stations need to communicate with people in other counties or other states. So all that information is still lacking. I don't know of any squads or fire departments that have recently purchased equipment. I know some of them are saying they're going to wait until they see what the tests produce until they want to spend the money. I think that's all I have.
Are there any specific areas that you need data from as far as digital coverage?
Yeah, I don't have it with me, but all of the people that haven't reported, well, it's mostly fire departments because the squads are, in further.
So are there particular parts in the county, or is it widespread? Is it one area?
Widespread.
Okay. But you do have a place where there's data gaps that you need?
Yes, I'll send members of the commission a list of what's missing,
Okay.
what areas.
Once you do that, maybe as Chief Greer can communicate that back out that we need data, and if not, is that something that maybe emergency services can help to do some testing? And I don't know, I'm just kind of brainstorming here to fill in the gap so we can move forward with a radio project.
Steve is sent out a lot of emails asking for those guys to go out and test. If it's an area we deem somebody wants to send us an email they have a problem with, and it's getting near the deadline or whatever, that we need to go out and test, and on some weekends when we have a lighter workload, then maybe we can go out and start trying to help with that testing.
Okay.
I have a feeling that we'll probably have to extend our plans for January 1st of 22 only because of the chips for radios are missing, and we're not going to get equipment in, I don't believe, like we want to. How do you know how Travis is doing? And
I haven't talked to Travis. I meant to talk to him this week, but unfortunately, we didn't catch up to get if he's even gotten a shipment date. I don't agree. I don't disagree with if it continues to roll on. That we need to wait. But if we start getting these I think the test, the units will go up very quickly once we actually get the product. I believe, at least for the test, to see if that helps. So I think let's get a date and kind of not push a date yet, because I think we have plenty of time. We have plenty of time. And the biggest thing that I want to emphasize is the radio that we're upgrading to still talks on the old system. And gives us an extra channel for those that where it works anyways. So it's not like we're having them change over to a system that doesn't talk to the system we have presently. And we already have that digital system in place. We're just trying to make that digital system better where we have gaps. So if you buy a digital radio, it's not like it's gonna be thrown out. We're gonna try to make it better. That's what we're doing the testing for. Ultimately, 20 years, 15, 10 years down the road, that may be a different story with a whole different system. In that case, we're talking, grant money or something like that to completely change the system that we've already started building out. Some of our issues, we have old radios. Trucks haven't been seen. Their antenna cables aren't right. We did one of ours just recently and really had not really a good communication, and we upgraded to a digital, and actually our regular radio channel, just the old fire channel talks better, just because it's a new radio, and it's different, it's newer technology. And really hadn't done the maintenance on radios. We don't touch our radios we don't have a radio person that's just ours. We have to, we contract that out, so we only have people touch them when there's something wrong, when sometimes we don't even know that something's wrong. So,
Just to find out exactly what position we're in, I recall that 21 was going to go around and collect information to see how many fire trucks and rescue trucks have new or old radios, so at least we get a handle on that.
Irwin's probably been working on that, Captain Irwin.
Because that will sure help.
The fleet of new engines that come in got digital radios?
Digital radios.
Okay.
That's all I have. Thank you.
Any questions, comments? Okay. All right, we'll move on to Director of Crime.
Physicals again, we have transferred more money in and to cover the cost. The very last physicals for this year will be June 3rd. North Greenville will be coming in for the last physicals that we've already paid for, and that budget is out. So we'll have to wait till in July to up it again, when the new budget comes in to provide more. It's a good problem to have. We've had lots of physicals. Yes, last time I shared the numbers with us, so the cost is up a little bit. The advantage is we actually have had more people get a physical this year than any year in recent years, so that's great. We want that. We want people to get physicals and be a part of our system, and that just shows, we still have a great group of people that still want to help our citizens in the county. So I applaud people for going out and getting their physicals for that. But June 3rd is that last date for this fiscal year's budget, to get that physical. And there are still some openings that we've already paid for on that physical day.
Where will that one be held at?
I will have to push it out, and I'm sorry, I didn't check. I thought it was going to Rescue 4, but that doesn't seem right, because I thought we just had one there. So I'll have to check. I'm sorry, I didn't check right before I left. We did confirm a date. I don't know if we've confirmed the place. Future incentive criteria, we have not met. Rescue Commission did give 2 names to. I'll be reaching out and try to get a date and time so that the 4, the 2 rescue and the 2 fire, and it was Mr. Grant and Mr. Brock from the Fire Commission for the incentive group. I'll be reaching out to you and the 2 from Rescue soon, so we can start doing that talk and try to get that rolling pretty quickly. I'd like to really come together and make that decision so people have the most amount of time to take care of what they need to take care of. And if whatever agreement we, come together to try to make sure we do the best we can with that incentive program to get the money to the people that deserve it. Financial reporting, once again, we need, people to start paying attention to that. We hope to have a training rolled out to where we can start moving people over to that platform that is gonna allow, us to be more, open and actually have a digital format of this so that it can be, we can run reports of it as we get, asked to for, by council and the administrator and those kind of things. We will be working again, we got busy and we did our part. And I'll do we'll do our best to get that project moving on our side. That's the holdup presently, right now. None of the squads have not done their work because we haven't done ours, so that's ours. I will, we will work on getting that finalized so we can push it out. There is no deadline to say you have to be on this program by any specific time. As soon as we get that rolled out to where we can start that training, we just want to ask that people are ready to kind of start transitioning to that, as this is the third year that we've kind of started and not done it. And I want to try to next year focus on, make it a goal next year to try to finalize that plan started 3 years ago with doing that. And other than questions or answers here, that's what I had.
Chief Greer?
Okay, so we've talked about this twice, about the helmet policy, and I've got actually accountability on there also. I've kind of put the two together, but the helmet policy is not really an accountability, it is a quick access to that firefighter. And after presenting this and talking about it at the last chief's meeting, as it looks at this time, we'll probably be voting on that at the next chief's meeting. And as it looks, and a lot of the chiefs, some are on board. I think the majority are on board, and there's some that are not on board, but that's okay. I mean, everybody deserves that opinion, but it looks like the majority, and it looks like that may pass. We'll find out then, but, so we should know something and vote on that at the next chief's meeting. The social media policy, you have that in front of you right here. I went in and changed all the verbiage and everything that was requested. And then it's got the actual offenses according to what it is. And then it's got a place on the back for signatures and everything. Just presenting this to you again. Looked at this also. This was something that Chief Crine asked me to do, and we kind of compared to the county's policy at the time. It either meets or exceeds county policy. And this is in depth, but not as in depth as the old policy. And actually gives those rescue chiefs, volunteer chiefs, and everyone out there that capability of managing their social media. Any questions on? Are y'all happy with the revision of it?
Again, talking, if you take a picture, you keep it on your phone, don't post it on nothing. That's the main thing it's talking about.
If you're in the duty of emergency services or your job, being a volunteer is a job, you're not supposed to share those pictures with others, other than the chief and those within their department can say, hey, for the department's purpose, can do it. Jamie, you look like you want to say something.
Well, I do, but I don't know if we've always got bystanders that's taking pictures. If there's a deputy or anybody on scene, can we ask them to
Step back.
that or delete the pictures?
If they're on public road, no. If they, on the public, they can't be on the person's premises or within the home or, but if they're on public road, unfortunately,
Okay.
that is, that is allowed. That's law. And that's actually why one of the things our old policy was not actually effective, or not effective, wasn't allowed, is because it did say that even the public wasn't allowed to. And if they're on a public road, this is about our members and what they get while they're on their own, while they're there for us, is what it's governing.
I'm all for it. I don't like it.
Yeah, we can request them to stop, but we
Yeah.
can't make them.
You can ask law enforcement to push them back, but that's about it.
Yeah.
Yep.
Yeah, I think we're all in agreement that that's where it needs to be, so, unless I'm wrong.
So do y'all want to, vote to accept this one, y'all, or?
Yeah, if you want us to vote, and, we can.
Good with it?
Yeah, I think we're good with it. so.
Okay, so. All right.
I'll make a motion, we accept the digital video camera policy.
Mr. McAllister's made a motion to accept the policy as proposed tonight.
I'll second it.
Have a second? Any discussion, further discussion? All those in favor of the proposed motion, or the motion on the, social media policy, raise your right hand. All those opposed? Being none, motion carries. Thank you.
Thank you, ma'am. The next thing is, of course, accountability was presented for us to work on also. And what I found was it slipped my mind. But the accountability passport system. So it was written on the passport system. We're talking about using our actual ID tags as accountability. Steve came by this morning. He's been by a few days. We've looked at it. And you guys have this paper in front of you also. Has the cards on it. I'm going to pass these around so you guys can see them. Don't pay attention to the mugshot on there. But the card A, the one with the black, that is actually representing a level 1, and that's the firefighter on scene. It will show your certification for as medical, and then it actually has what department you're with, if you're medical or hazmat. If you want to put a block on there, it can be blue for medical, a green block for hazmat. And on the back, it actually has all your training that you have. And that would be the one that gets you interior or in the IDLH, the hot zone, things of that nature, for those individuals trained to that level. Card B is actually the exterior, the yellow card. So that would be those people that are just level 2. It's got the level on there, and you kind of see on that one, it's actually got the green block and the blue block for medical and hazmat. And then it's got the training on the back. You've got the C card, which is actually for like your rescue members. So that would be them on the medical side, shows them in blue. And if you drop, it's got their training, it would have their level, same concept. He's got one on here, card D, which is actually special rescue, just plain white card, shows their level and their training, they should be level 1, 2. And Then you have actually the green, same thing here. That would be your hazmat folks that are just hazmat. If that's all they're doing at that point in time, their level. Of course, again, remember hazmat, they're gonna be an IDLH, those members. So if they were green, and they're actually gonna be in that hot zone, then that's what they would need. And then if you look at the yellow card, that is actually administration. So we could have a card for those members that just do administration. And then, of course, Steve had made some of these, the orange cards for our explorers. Kind of gives them something to hold on to, something to put in their pocket, and if a restaurant's giving 10% off a hamburger, or they get something in a movie, it gives them a little something tangible to hold on to, being explored. Just want to present those to you. I know that's a lot, and if that doesn't work, my theory is to just go with black as interior. That's your IDLH, hot zone and everything. If you go yellow, and that is your actual exterior, it shows them also. And then you would go with, so you'd have black, yellow, and I think it would be easier to keep those. And then if we just went with the yellow for admin and the orange for explorer, would make it. So do you want to go with like seven cards? Or do you think
Under the-
4 cards?
Under the pretense of, and I'm asking because is, you're only gonna get one card, the highest level you have.
Right.
It's not like you're gonna, it's not, we're not gonna sit there and go, here's your cards, you know, because you're qualified for everything. It would be whatever that highest level you're at,
Yes.
you know. Does it make, you know?
I think the
So it's got to do with their physical and their training.
Right.
And then, of course, this is where the accountability comes in, to where a card, he knows we're good to go inside. If we come up and we give him a yellow, then he knows where it's steered. But he also should be able to look with the helmet policy in place, and that's because white helmet gets a black card, red helmet gets a black card, black helmet gets a black card. Hazmat, if you're level 1, you're doing all the hazmat stuff, you're getting a black card. You're rescue, you're doing all the rescue, you're going to get a black card. Because you're trained to that level to be in that area of the IDLH or hot zone of what's going on at that point in time.
I think one of the major benefits of having these cards is, of course, when we get to a scene, everyone's gonna throw their card in something, a pile. But let's say something happens on scene and they need somebody medical, and they can just quickly look in this pile and see who has the right colored dot and say, hey, Joe Blow, come over here, we need you to do something. Even if the fireman, if he's tagged for EMR or EMT, we can grab him. Same thing with hazmat. We know which people are hazmat qualified. Otherwise, we wouldn't know. That's the benefit of having these other colors.
And I wanted to get an idea if this is an area that we need to go. 7 cars may be too many. 4 cars may simplify, and we can do the same thing.
Well, I think if you just do 4 cards, hot zone, cold zone, outside zone,
And that's kind of what the black and yellow represent.
orange for the kids that are getting their fire. But then, like I say, on the black card, you can put the blue dot or whatever for EMR, EMT. That'd be my thoughts, go with just 4 cars instead of 7 cars.
Well, right off the bat, the orange cards are gonna be very few. Explorers, I don't remember the last time I made an Explorer card,
Oakland
maybe
has
2-3 years
a lot.
ago. And as far as administrative, most administrators are not allowed on scene, so we're never gonna see those. We will see,
But they can, and that's why they would need that.
Food, they're delivering food, but they're not allowed to operate.
Right.
Right.
or the religious people we have.
Right.
But very few of those, so that only leaves 5. But anyway,
That only leaves 5 cards. The 2 are limited. I see.
Well, and again, I mean, every department's not gonna be faced with, you know, all these choices, and I think we're on the right track. I like it.
So, y'all think the 7 or the 4?
Well, that begs the question, who's gonna manage the program? I guess that's, I guess
Well, I
that's
think
how.
if we narrow this down to what we kind of want to see, then that allows me to go back in to the accountability part and make the accountability, once we rewrite, match what we're going to do, because what's there now matches nothing.
Exactly, exactly. So, you know, who's gonna be the card manager? And as far as, the department's gonna continue to get the sheets, and we fill out what everybody is, and it goes to whomever, and they
Steve.
decide, okay, they get card C, so the chiefs don't have to figure out which card they
Right.
get, okay.
but one thing, the chiefs have to realize that when they sign their name on the bottom of that sheet, they're testifying.
Yeah, yeah.
That is the certs that that person has.
Right, but they're not gonna have to tell you,
No.
you know, firefighter Burton gets card C or B, okay? That'll be whoever, when you create the card. Well, I think that'll eliminate a lot of confusion, and it'd take some education on incident commanders or
And that's something
accountability.
if Steve's going to make those, he and I can work together on that far as,
Just to educate the, you know, people that do use an accountability system, and hopefully this helps us move forward to having one that, you know, these are the high points of the cards, and if there's a blue or a green dot, that's what it means,
so
so.
you saying go with the 4 cards also?
I like it the way it's presented now,
Okay.
but that's just my opinion.
I like the 4 cards.
You like the 4?
Less confusion. When you're on the same.
And I can see that, yeah, I can see that.
No, and that's what I'll get at. Whatever gonna
Like
be
I do
something
to
for y'all to
black line, make a white dot.
maintain and
So an easy way to fix, if you want to do 7, we can do 7. If you want to do 4, we can do the 4, the blue dot for medical, green dot for, or the green square for hazmat, and we can do a black outline on the white card where it shows a white to where those folks are special rescue.
All right. I think we could do away with this card. There are so few members of hazmat. And I hate to say it, I gave you the sheet before, so many of those members don't even have physicals. They don't have levels.
And most of them are firefighters also. So they're already gonna have a black card.
I looked in the system today for all of them.
Oh, okay.
And very few have physicals.
Oh, okay.
You know, but, so,
We'll talk about that later.
yeah. So this is one we could do away with. And then we'd be left with 4.
4 standards with the other 2 colors.
Yeah, and we could still use the green dot on those other cards.
Kind of a hybrid there.
Yeah,
Yeah,
it's incorporating the 7 cards into 4 cards.
correct,
Right.
correct.
If we kind of do it.
Actually 6, but.
Yeah.
Because you're leaving those 2, but they're so different. They're very few.
So do y'all want to try to, look at bringing the 4 cards, 6 cards next time, look at it again, or I mean, we don't, I'm willing to work on it with Steve again. And like I say, we don't have to make a hard decision tonight on it, but it gives us a pathway of go towards 4 or go towards the other amount.
So we table it till y'all figure out what's easiest for y'all. 4 cars or 7 cars.
Okay.
All right, I'll work on that.
Did a jam up job on that, so.
Yeah, I like it. I appreciate y'all coming up with that. I think
Steve
that's
was a
the
big part of that. Thank you, Steve.
direction we need to go.
So
Yeah, I guess y'all make the hybrid system and we'll figure out the nuts and, or, you know, how it works in operations and go on.
And the other form you have, thank you guys, the other form you have is the health and fitness evaluation and or physical physician clearance form. This is something that the commission challenged us to try to put together in the beginning of coming on, and it's got everything that's kind of required there in the steps for a physical. So if someone goes outside of North Greenville or upstate, I know there's some individuals in the past, just hearsay, or they work with someone that does a physical, hopefully to this standard, that we have on here. NFPA OSHA standards has a place for the physician, the patient, and the county chief to sign. And then also on the back side of that form, it breaks it down so that physician can kind of tell what regulation is being met with the physical.
Will we still need to do this if we just get the OSHA Fire Brigade clearance form that comes, like
No,
the fitness
no.
form does, or?
If you're,
Ours is a fire ground physical. There is a difference between fire brigade and fire ground, and so we need to make sure that,
the wording is fire brigade by the standard,
Right.
but it's recognized as a fire ground physical. So that's where you go to either North Greenville and do it, and then upstate does a similar physical. But this is for if someone's plant or somebody's doing physicals to this standard, then we have a form that physician can actually sign for that individual that they meet the standard.
so yes, like Clemson uses a different company that does fire physicals.
Yeah, it's fitness form.
Correct. But they also have signed people off without putting a stress test on that person.
Really?
Yes.
Huh.
So that's why we're ensuring the doctor is signing, saying they have done a physical stress test, not just sign someone off.
Okay.
Now, it says.
I've always had to do a stress test, so I didn't know that was an
It says here
issue.
on here for a bike, graded exercise. What about a treadmill? Would that not?
It's on there. Well, I thought.
About number 6,
Yeah, number 6.
I thought I added it. I must have printed the wrong one.
Yeah, it's supposed to be bike and.
It should say treadmill also.
Yeah, bike or treadmill, yes.
Yes.
What about a cardiac stress test?
But I printed the wrong one.
You mean a
So
chemical stress test?
it should say bike and treadmill on that.
We'll have to look at that. That's how your cardiologist clears it. But he usually has to do a chemical stress test because you're not able to get on the bike. Or if you're not able to get on the bike or the treadmill, you probably shouldn't be having a fire
Yeah, I
clearance.
think it's a physical stress test and stuff, yeah.
Yeah, the difference between a chemical and a physical, the way that's read, you're supposed to have a physical stress test.
Well, it's still level 3 that we don't have anymore.
Correct.
Yeah.
So,
So is it going to be accepted?
No.
For level 3,
there is no level 3
for
after.
level 2?
For level 2, you have to pass that. You still have to have a stress test. And that is to be on scene, the regulation specifically says you have a physical stress test.
Other than, I need to put the treadmill on there. Other than that, do you guys like the form as presented?
I mean, if this goes to somebody's personal physician or whomever that's outside what the county offers, yeah, I mean, as long as it meets standard, I think that'd be good to come up with a form on your own, so, yeah. Yeah, I'm okay with it.
Me too. Good with me.
Idea was to clarify what a doctor is signing for when he says he's clearing a person for that physical, to actually make sure we're comparing apples to apples.
Any other questions on that one?
Like somebody want to go to the personal doctor, where do they get this form?
We'll put this in ERS.
Put it out,
The county will not pay for that.
not your personal doctor.
The only thing the county will pay for is for upstate and for
North Greenville.
North Greenville. Those are our contracts.
So I'll fix that and, see if I can get that in the ERS. So we kinda hit the physical levels already. So I'll skip that one. Personnel, I know that's been a hot topic, seems like every time we meet. The new guys are out in the stations now, so hopefully you guys are seeing that. They've done very well in their training, far as their recruit class. They've done well in the training that the captains and battalion had them in while they were in their 6 weeks. Done very well with that, and hopefully they're going to turn out to be stellar employees. So far, no complaints at this time, which is good. And we hope with budget that we are able to fulfill all of our staffing and put more people in departments. So that's kind of where we're at with the personnel now. And squads are out there running calls. So any questions on the personnel?
Couple of new guys, they shouldn't be doing fine, yeah.
Far as the new, if no other questions, I'll move to the apparatus. The new apparatus, of course, all 6 of those trucks are in service now. And of course, 21 staff doing hose test and loading of all those trucks. And of course, Honeycutt working with getting the old truck swapped and everything. That went well. We learned some things while we were doing that the trucks needed an extra step on the rear of it. They're looking at where the radio was mounted. They're calling it a Z-track, where they'll actually mount that to where a driver doesn't have to lean over to kind of see the radio. They're going to put that Z-track where it kind of bolts to the back of there and turns that radio so the driver can see it easily driving down the road. So that's something they're working on. Assistant Chief Norris, he brought up about a switch on the rear. So if you're working at night, somebody's back there, instead of cutting all the lights on, a little toggle switch on the back with a little protector on it to where you can cut those lights on there while you're loading or somebody backing someone up. So we did find some things that needed to be added and kind of tweak the trucks, and all those will be fixed here pretty soon by Spartan. And also, we've went through prelim on the other 2 new trucks and signed the paperwork on those. So they should be working on those shortly. Any questions on new apparatus? The update on the AFG, yes, sir?
You have a list of where they all went? I've never seen
What?
an actual list of where the new ones went and where the
Station
2 additional.
19, there is a list. I don't have that list with me. I'm trying to see if I can remember all of them. Station 19 got one. Holly Springs,
11.
11,
14.
15,
And 14.
and 14.
That's fine.
That's fine.
2, Station 2.
And the two that y'all were processing,
Mount Rest and Cleveland.
and are those apparatus that are being replaced, are they going back in a rotation for spares or reserve pumpers? Are they being,
Some of the apparatus are going to go to the boneyard because they've met their requirement, they met their time, they're tired, and it's time for them to go. Honeycutt is working with Dwayne on that. That's something those 2 are working on. 2 of the apparatus are being rolled back into training. So we will actually have a Engine 21 at Westminster Fire. So we're not pulling someone's apparatus to do training with, because there's been many times we're doing training, Assistant Chief Norris and myself, and then of course they get a call, we have to stop training. And it prolongs the class. So we will have a truck that can be used as a actual responding vehicle, but it's going to be used as a training apparatus. Plus, there will be training apparatus at the tower, because when you're putting on the pump ops class, you need 2 apparatus. So instead of pulling someone's apparatus down, that would bring 2 of them down. So it's just smart to do it this way, since they're still usable for a few more years.
We actually took the engine that was replaced from the Career Center and actually just turned it into our training. Instead of having one sit at the Career Center, it is now part of the 2 of the train center. And so one at Westminster, one at the burn building, so that we have those 2 instead of having the one that we don't have anymore, because that program, and we'll support it again if that program comes back. But it's a 25-year replacement plan. It's 20 years replacement plan, and if that vehicle rolls into one of the other vehicles at that station, or out of that station to Whetstone or one of those as a reserve or whatever for the last 5 years of its life, if it's serviceable.
where does this, now that we've got 6, 7, 8, where does this put us in our replacement plan? How far ahead does this push us?
It doesn't.
Okay.
Doesn't put us ahead at all. It actually catches us up some. If you remember correctly, we were 3 behind when we started 3 years ago. So the 6 just coming in. So this year's budget, there's still another fire truck in it. Plus money for air packs. If to make some of that change if we have to, or if we get the, AFG grant. And then also, other vehicles that were on that list for replacement. But then it also allows us, depending on the air pack situation, the next big group would be the tankers that are actually starting to exceed their time also very quickly. So that's the next biggest group. There may be some fire trucks, I don't have it memorized, right, in one or two there and there, but the biggest purchase of them, until we start replacing the ones or two fire trucks, but then the tankers all come due next few years.
Any other questions on apparatus? The AFG grant, they are looking at it. Matter of fact, since Chief Norris looked at, they contacted him. There was something that he had to correct on verbiage. So that's good that they have that and they're looking in depth at it. That's been corrected. So
I would
hopefully,
actually say clarification on verbiage.
Yes. Yes.
It was a clarification, which is a good
Yeah.
thing.
very, very good thing.
So,
So that's where the AFG grant is right now. So it is in hand and they are looking at it. The hose testing was brought up to the chiefs. The majority that was in the room that evening are on board far as looking at going ahead and trying to get third-party testing done for the actual fire hose. That's something that, we need further discussion because some departments even made the comment that if we don't do it, then they're gonna pay for it out of their own pocket, which is fine. But it's, according to what we want to do there, far as going third-party on hose testing.
understand that if the commission pushes, that will come out of the department's money. There is not money in the budget for next year for hose testing. So if this committee chooses that's the way to push us, it will get charged back to each individual department for the engine that's in their station. Because they're choosing not to go that route that costs us money instead of having volunteers and staff do that hose testing.
One of the departments looked into it, and I think to test their whole department, it was gonna cost them like $900.
But the majority, all of them don't get on board. Because the majority not rule, say like 15 of the toilet stations said to do it, so we gonna do it.
You're the advisory committee to tell, to go back to your departments and see how many of them say yes and how many of them say no, and you can advise us which way to go, and we don't mind going out to do the contract to say, hey, we're paying for XYZ number of feet, which would get us a better price, and then that would come off of if we choose to do it for everyone across the board, we would just say 5 engines were done here, 5 engines were done there, whatever that may be would come directly off of your county your county check before you got it the next quarter, is how that would, like we've done other things that you wanted to purchase, it would just come off that check, so you would see a line item that would be your check instead of 15,000 each time. I think that's, would be short the amount of that, hose testing.
They give you a report, far as all hose tested, and, I think they actually number your hose. I think that's part of it, says Chief Norris.
Depending.
That's something that can be done also. But the more footage that we test, the cheaper it will be if everybody's on board versus 3 departments say, I don't want to do it. But if you guys want to take that back to your districts, talk to them and see what they want to do, that's something definitely, and I know Chief Burton, he brought it up last time that, municipals may even want to look at getting in on that also.
How much was it a foot? You remember?
If you get municipals involved and everyone, the last quote that Assistant Chief Norris got was anywhere from 25 to 27 cents a foot.
That's what I was thinking, and I just roughly did some math for mine, and it would come up to about 1,500 for me to do mine, that crossroads.
Yeah.
I did it at 25 cents a foot.
Okay. Yes, sir.
Don't forget about the hose testing, ladder testing that's in there, and the pumper testing.
So, that's something also that the county right now does the pumper testing. So if we want to go third party on the pumper testing, we can go third party on the pumper testing. So we're already doing the ladders. Ladders are already third party tested.
Air pack too.
Air packs are flow tested too.
Yes.
That's my motion.
So if y'all want to look at the ladder testing is already done. So if y'all want to look into the hose testing and then look at pump testing, then everything's covered. Third party, you get reports for your department. We get reports for when, we have to look at when ISO comes in. So we had to have that there. So we will have everyone's info there at headquarters.
So we get quotes on the pumper test and everything.
That's something, if y'all want to go back and talk to your districts about, and next meeting, if y'all want to look at that, then that's something, we can start putting together as far as cost on pump testing. Who all is in, what departments are in, is,
That
know,
money would come out of the state.
operations.
Because I know in the past, some of the counties paid for it, like the pump testing and the ladder testing.
Well, the pump testing, has been done by the county.
The pump testing is done by our county staff.
Yes, staff.
Ladder testing is in the budget presently. Pump testing and hose testing is not in the maintenance budget. And we've had to transfer money into maintenance budget this year already to cover all the different costs.
So probably what we need to do is just look at the whole thing and have an NFPA testing contract for your ladders, pumps, hoses, and air packs, and come together with a proposal for that.
If everybody's in agreement, then we find out how many, who, and get that to those individuals to quote.
Because if you're struggling now to get everything done, I would make the suggestion to go ahead and look about putting together a NFPA testing contract.
Okay.
It may be different pieces to it, but do a complete package. That way the stations can have a ballpark idea of how much it's gonna cost per year to meet NFPA testing requirements.
Okay. Y'all take that back, talk to your districts, and, if everybody's on board, then this is something that we can move forward with.
Because it's a hassle with one station trying to schedule different things.
Yes, sir.
As far as this month is hose testing, this month is ladder testing, and if it's by contract, by year, the conditions are by the contractor to come and take care of that stuff.
And everybody sees the call volume just keeps going up.
Exactly.
Well, that's the hassle to me, is the volunteers are falling off, and everybody, just get people out there to do all of that stuff.
A lot of work.
We loaded 6 trucks, 21 staff in 2 days. Those guys worked very hard
And tested hose.
and tested those.
Yes. And all that time, you could have been doing something else, working on these cards or.
Well, and everybody talks about people being pulled out of a station, then it's not 2 people to hose test, that's a job. And when you start bringing people together to do that, then you're taking them out of places people say, I don't want that guy to leave. So, it will kind of help with that too.
Some other company does that, they've got to stay there and run calls or do whatever.
But that,
Probably when putting that together, I know they won't come to every station. I have to figure out a system
it,
to at least cluster stuff together, so you're not having to bring a fire truck from Fairplay to Mountain Rest or vice versa.
normally on the ladder testing, they pick sites and then you bring the apparatus to that site to where they're testing. And, of course, the, pumper testing, that's the ones that I know of has always been done out at the, training tower. With a test pit, but if you get somebody that comes in, like some companies,
They bring a mobile.
they have
test
the
kit.
mobile testing, so, normally they will probably move around to a site to where, because of all the travel, the miles and all, we can probably bring the equipment to them better than them moving around.
And then your 21 guys working there could handle that
Yeah.
here today.
But if y'all take that back, let us know if districts are on board and all, that's something we will move forward with. That's all I have.
More questions? All right, we'll move into the regional commissioner updates. Region 1. I have a letter from our Region 1 Commissioner, Mr. Collins, addressed it to the Fire Commission. It's with great sadness that effective immediately I'll be resigning as Region 1 representative on the Fire Service Advisory Commission due to the constant ongoing hostile actions and false accusations. I feel I cannot effectively represent my region at this time. I will always be available to answer questions or provide assistance in any way possible to help our fire service. The Fire Service Advisory Commission was established to assist in decision-making for the many great volunteers in our county and should always be the main goal. I have past minutes, plans, and supporting documents which the previous commissions established and approved from the past several years to assist you if needed. Thank you for allowing me the honor of representing you in the past and hope one day I will be able to serve you again. Best regards, Chief Cleveland Fire Department, Travis Collins. Appreciate Mr. Collins' work on the Fire Commission that he's done. Appreciate the time that he committed to better the fire service in the county. With that, be a vacancy on the board. Y'all will work to
We will work with those, departments to,
fill that position.
fill that position, take nominations, fill that position, and fill the board.
I don't have any other information from Region 1 unless y'all do. Region 2.
Region 2, we have nothing this time. I talked with the chiefs. They didn't have anything right now. But I'll get with them on this testing stuff. We'll go from there.
Thank you, Chief.
Region 3.
Did reach out by email to Chief at 12 and 17. I did mention in that email about letting you, sir, know about the radio dead zones and mutual aid channels. I've not heard back yet, but if I do, I will forward those along. Other than that, I don't have any update.
Region 4.
Maybe anything.
Region 5, not much. I did have a few questions. There was some discussion about helicopter insurance type
Yes.
things.
I actually met with him today, the new ambulance, or the new air ambulance, helicopter. I don't think it's gonna be as bad as we originally had thought. We will be discussing with them. No, our insurance does not work, but they have, you know, it reiterated us, that they will work with us, in making sure the right helicopter, the closest helicopter is sent. It's not just gonna be them. And they also reiterated some of the advantages of their helicopter in that, it's an IFR, which means sometimes when Med-Trans and those can't fly, they would be able to fly, as long as the scene is clear. They are not legally allowed to land IFR at the hospital or at the, or at our scene, but if there's a storm in between here and there, that doesn't stop them. like it does a helicopter. We will be working with them to get more information on how that works. But they were adamant that they stopped doing their subscription program because by using an advocate, they are actually in network for Blue Cross Blue Shield and some of those that they were actually able to reduce the overall cost to their constituents overall. And they have a program to make sure that they get the most that they can get out of insurance in those without putting a huge burden on the citizen. In that they have a method to do that instead of just a subscription program that if it's never used, it's just money in their pocket. So that's why that company has chosen to go that way. We will continue to work with them and how that's gonna interface, but we will see that helicopter June 1. A lot sooner than we expected. It's a little bigger helicopter than we're used to coming in. It's a dual engine, clamshell back basically, so it's a rear load. So we will have to do some training and get people out, and we're gonna talk about some options to do that, so people have seen it beforehand, then when it's on scene. But it doesn't mean everything's free. You know, we pay for a lot of helicopter insurance. Right now, I think we made the right choice of paying for this year, and I think we still need to, as this moves forward and we start pulling data. MedTrans or Life Flight is gonna still be closer on the lower end, and that's the closest helicopter. And they agreed, the closest helicopter needs to come to the scene. Not just them, it is what is that best facility, or best, location or speed for that patient, not just everyone going to them, because it's all, they're working with the hospital. So with that, it was a very good meeting, to kick off a lot of options for us. I don't think, I think we're gonna have to work on how it looks for us, but I don't think in the field, and our firefighters won't see a difference. They're gonna see a different helicopter. We're just gonna have to really work with them if there is a bill involved at some point.
I know some of us in the municipalities met, y'all still ironing out box alarm response schedules, that stuff, that's still,
Yes, sir.
okay. All right. Any idea, timeline on when, do we need to meet again and go over some of that, or?
I think we pretty much had the municipalities, we have all the info on those, where now, instead of them going in and changing 3 or 4 at a time, we're trying to look at, since Chief Norris and myself talked about it, and trying to go in. He's done a lot with talking to some on the phone. As I'm going out and meeting some, I'm taking those with me to the departments, and we're gonna try to dump all that at one time, so we're not just random here and there. Change those second alarm boxes.
Is that gonna be reflected? I noticed the website to look at the alarms, the sheriff's office website's different now. Is that gonna be to where, are we still gonna be able to log on and look at them?
We're going through that.
Okay,
As the changeover happens, we're gonna make sure that there's a way to look,
yeah,
once we get
okay,
that changeover finished.
okay.
The thing of it was, a lot of folks didn't even know we had that. So, I mean, it's a good thing.
Yeah, it was good to get on there and be able to look and see, so, okay, good deal. That's all I have for Region 5. I don't have any comments as a chairman.
I have one thing from before we, Rescue 4 is where it is gonna be for the physicals, for that, June 30th, is Rescue 4.
What time?
That will be from 4 to 9, I believe, is when the scheduled, 4 to 8:30, sorry. Whenever that time, whatever time's available, I don't know how many people are on that yet.
You said that was June 3rd?
June 3rd.
Third.
That's North Greenville.
North Greenville, yes.
That's all I have. Should be anything unfinished, so we have a motion to adjourn.
Motion.
Motion to adjourn. All those in favor? Second.